This video is one of a series on hereditary cancer, which is the reason that some families have an unusually strong pattern of cancer that's passed down through the generations. If you haven't already, I recommend starting with the introduction to hereditary cancer because this will give you a lot of the background information that will be helpful in understanding the other videos. In this video, I want to talk about something that's quite specific, which is how genetic counselors or other genetics experts compare test results between people in the family to get the most information, and why it is sometimes more helpful to test some certain people in the family. And this could be a helpful video if someone in your family has asked you to do genetic testing and you're trying to figure out, why you were asked to do that, or if you saw a genetic counselor or other expert who recommended that your aunt or mother or uncle have genetic testing, and you, again, sort of want to get a good understanding of why that's important. I briefly want to remind you that most cancers are actually not inherited. Most of these cancers that we see in families are caused by aging, lifestyle, and environment, and not by genetic risk factors. But there are some families that have what we call hereditary cancer, where there's a very strong inherited risk factor for cancer, and the people in the family who have that do have a higher chance of getting cancer than the average person. Also, some of the people in these families will not have the inherited risk factor and they won't have a higher risk of getting cancer. So genetic testing can be very useful for sorting out who is at higher risk and who isn't, and giving an opportunity to do some early detection and prevention for those people who are at higher risk. Even in this age of really quite advanced genetic testing, we still rely very heavily on family history combined with genetic testing to give us the most information about what's causing cancer in the family and what someone's risk is and what type of monitoring and prevention they should do. I've talked in some of the other videos more about family history, and this video is going to focus more on the genetic testing. Genetic testing is done on a blood sample or saliva sample, and in the case of hereditary cancer, they're focusing in on the tumor suppressor genes, so genes that we know are normally giving instructions for protecting us from getting cancer, and some people have what we call a mutation in one of these genes, meaning there's like a spelling mistake in the gene and it doesn't work properly anymore. We have two copies of most tumor suppressor genes, one from our mom and one from our dad, and the mutations that we see are usually just on one copy. So even someone who has this inherited mutation or inherited risk factor for cancer also has another copy of that same gene that's working properly from their other parent. And when this person goes to have children, he or she will pass on just one copy of this gene because the other copy comes from the other parent. So sometimes this person will pass on the copy of the gene that has the mutation, and sometimes he or she will pass on the copy that does not have the mutation. You can see how this means that even in a family with inherited cancer, some of the people did not inherit this risk factor. And if we do genetic testing and we test this person who does not have a mutation, we may really miss what's going on in the family and not have a complete picture of what's going on. So we try very hard in genetic counseling to look at family histories and find the person or people in the family whose test is going to give us the most information, not just for that person, but really for the whole family. And it might be easier to explain this by looking at a sort of made-up family. So I have a person here named Kelly, and she's a young woman who's concerned about her family history because on her dad's side of the family, she has an aunt who developed ovarian cancer in her 50s and another aunt who had breast cancer in her 40s. So this combination of early cancers and breast and ovarian cancer in a family is one of the things, or a few of the things, that we make us suspect inherited risk factors. If Kelly looked at that family history and was concerned about inherited risk factors, which is very reasonable, and then she had genetic testing, her genetic test might come back negative. And that's certainly not bad news, but it doesn't give us a complete picture because we don't have tests for all the things that could cause cancer. And so while I'd like to be able to tell her that you did not inherit a high risk for breast and ovarian cancer, we can't really be certain because it's possible that her aunts test results would also be negative, meaning there's something else causing cancer in this family, and Kelly's negative test result doesn't really help us in any way. On the other hand, if her aunts do have a mutation in the gene or genes that Kelly was tested for, and Kelly didn't inherit it, that tells us a lot more. That's actually a really reassuring type of result. We call that a true negative, when we know what's causing the cancer in the family and somebody clearly does not have it. So you can see how Kelly's test result, while it's nice to get a negative test result, really leaves us a little bit in sort of unclear territory until we can compare it to one of her aunt's results. If we take a look at this same family but start testing in the family from a different angle, we get a sort of a different story. So if we start testing with her aunts and they don't have a mutation, then right away we know that this is a family where, even though there's this strong history of cancer, it's not something that is explained by the test that we have right now. And we don't actually recommend testing for other people in the family at that point, because we would say, you know what, there is cancer in your family, but it's not linked to a mutation that we can test for. So whether you have, whatever your test looks like, it's probably not relevant to this family history. And we might still recommend some type of increased monitoring for Kelly and her family, and we certainly would recommend that they go back in the future to consider new tests as they become available. But really, there we've done 1 or 2 tests in those aunts. If we don't see anything, then we're kind of done for the whole family in terms of genetic testing at this time. On the other hand, if we do testing for those aunts and we do find a mutation, now we have this very clear tool to go to anyone else in the family and say, here's what's causing the cancer in your family. Did you inherit it or did you not? So at this point, if we found a mutation in her aunts, Kelly could certainly go ahead and have testing herself. I might actually recommend that her dad get testing first, partly for him. A lot of men don't think about how hereditary breast and ovarian cancer could affect them, but men in those families do get some cancers, sometimes male breast cancer or prostate cancer. So that's one reason for him to test. The other reason for him to test is, if he has a mutation, that's fine. We know that Kelly should still test. But if he doesn't have the mutation, then he doesn't have a mutation to pass on to Kelly, and she actually doesn't need to be tested. And actually, any brothers or sisters that she has also don't need to be tested. And so by doing the test for her dad, we may actually save testing for several other people in the family. So again, you can sort of see how when we start with the people with cancer, we can either, rule out the need for any further testing or get this really clear yes or no test for people in the family. Of course, it happens sometimes, every family is different, that the people who've had cancer in the family might not be able to test. They might not want to do testing. They might live somewhere where they don't have access to testing in another country, or those people may have passed away. So although we really ideally get the most information from the people in the family who've had cancer, when that's not possible, then the next recommendation is to go to the people in the family who are closest relatives. So again, if we couldn't test Kelly's aunts, I would actually recommend starting testing with Kelly's dad with that same idea, that if his test is negative, then we don't really have a useful test to use in this family, and Kelly and her siblings don't need to get tested. And if his test is positive, meaning we found a mutation, now we have that really clear yes or no tool to go to everyone else in the family. So I hope that giving those examples helps you understand why we often recommend that genetic testing start with someone in the family who's had cancer, especially cancer at a young age. And when that's not possible, then we would recommend starting with another person who's most closely related to those people who've had cancer. I've mentioned this before, and I'll mention again, of course, every family is different, and every individual person's situation is different, and there are so many different genetic tests out there. So this video is not meant to be a substitute for having somebody take an individualized look at your history, but hopefully it helps give you a clearer picture of how we use genetic testing and compare results between people in the family to get the most information, and why it sometimes makes sense for certain people in the family to be the first ones to get testing.